At the event, there was a standby crew of approximately 16 EMS paramedic personnel from Community Ambulance. They performed wonderfully under fire, literally under fire, taking care of patients that were right there in front of them in a very bad situation. So my hat's off to that standby EMS crew.
That's the Clark County Fire Chief commending the job done by first responders that were called to the chaotic scene of last Sunday's mass shooting in Las Vegas. In situations like these, first responders and ER doctors have to make split-second decisions to save as many lives as possible. For more on this, joining me now is Dr. Manny Alvarez. He's the senior managing editor right here at FoxNewsHealth.com. Dr. Alvarez, thanks so much for being here.
You got it.
I want to get a quick temperature check from you on what happened last weekend. How did first responders do overall? What's the sentiment about that? Is this something that the victims and their families, and by extension all of us Americans, should be happy with?
I think we should be happy. I think we should be proud. It brings almost tears to my eyes because, you know, when you go into medicine, either whether you're a nurse or any kind of technical person in a hospital, you know, you go in there trying to fix problems, disease diagnosis, surgery, and so on and so forth. You know, for the last couple of years, every trauma center in the U.S., every hospital in the U.S. has had to transform itself into almost like a warlike mentality. You know, it's like a MASH unit, and we never really, I mean, we had dealt with, you know, automobile accidents and fires and things of the sort, but now it's like mass shootings with dozens of injuries that are, you know, typically found only in war fields. So the whole transformation and the quick transformation that these ER doctors, nurses, and everybody else have to undergo and react to the way that they're reacting and having the outcomes that they're having is, you know, a miracle. And it really, you know, my brothers and sisters, I can't say, you know, how proud I am of those groups of people.
I mean, one thing that was really highlighted in the wake of Vegas was just how incredible the first responders in the area were.
Yeah.
Just how seamlessly and flawlessly they were able to, as you say, expand their capacity for these people who are affected, who are victims of this shooting.
Yeah.
I want to ask you, is there a lesson that we can kind of pull out of Vegas, or are there many lessons? What are you thinking?
I think that we're learning lessons every day, and as I said, now we are in this domestic terrorist war, whether it's from terrorists or even madmen and that are creating mass shootings. So now we're learning lessons. I have to tell you, we wrote a piece today, and you could read it in FoxNews.com opinion. But you know what I'm saying is, nowadays we have to look at the staffing of our hospitals, and especially staffing when it comes to big areas where you're having, you know, big parties or concerts. You have to look at bringing back first aid education to schools. Kids, you know, I taught my kids how to do CPR, how to put on a tourniquet, how to deal with penetrating wounds. We have to get some sort of basic health first aid education back into our schools. Number two, we have to kind of teach the public that just don't wait when we have a crisis to donate blood. You know, as soon as we have these crises, you have an uptick in blood donations, and then a week or two from now, we have again empty blood banks. So we have to kind of change the attitude where everybody's a participant. You could be, you know, anybody could be the first responder, especially if you have somebody next to you who just got shot. So again, these skills now become sort of mandatory because everybody wants to help. And unfortunately, until all of this gets under control, we are not only victims, but we're also our participants in helping others survive.
So how do you think this should work inside American families? I know you mentioned starting early with childhood education, but what can us adults do? Is it important that we get some kind of training and then we impart that to our children, or leave it to professionals?
You could do it in many ways. You could do it as a parental unit. You could do it in schools. You can have community classes in your neighborhoods where the local firemen or personnel from the hospital can go and teach. I mean, there's many ways. The point is that we need to expose our communities more than ever on first aid because, as you know, as we saw here in Vegas, a lot of the life-saving things that happen is because the citizens took it upon themselves to put the injured, you know, press down on the bleeding, run with a pickup truck or a taxi cab immediately to the hospital. Those things make the mortalities go down, and unfortunately, this is kind of becoming something that we see very frequently, and we have to do something and learn from it.
So the takeaway is all Americans have a role to play.
Absolutely.
Everyone can help. No gesture, no education
Absolutely.
is too small. Dr. Alvarez, thanks so much for joining us today.